Hello everyone again. Unit 2, Health Matters. Okay, to begin with the unit, we have kind of a website in here that gives us some advice on how to deal with a dental emergency abroad. Okay, so we can discuss that in class. Then we have how to make uh, an appointment for an emergency in a hospital or at the dentist. Let's listen.
Page 15. Exercise C. Photo story. Read and listen to someone with a dental emergency during a trip.
I need to see a dentist as soon as possible. I think it's an emergency. I was wondering if you might be able to recommend someone who speaks English.
Let me check. Actually, there is one not far from here. Would you like me to make an appointment for you?
If you could, thanks. I'm in a lot of pain.
So, I hear you from overseas.
From Ecuador. Thanks for fitting me in.
Luckily, I had a cancellation. So, what brings you in today?
Well, this tooth is killing me.
When did it first begin to hurt?
It's been bothering me since last night.
Let's have a look. Open wide.
Ah.
Well, let's take an x-ray and see what's going on.
So, as you can see, this is basically the conversation we're going to have with the dentist or with the doctor abroad or with the receptionist. Okay? So, then we have call in sick. So, we have some new vocabulary. Okay? Let's listen.
Page 16. Vocabulary. Symptoms. Exercise A. Read and listen.
I feel dizzy. I feel nauseous. I feel weak. I feel short of breath.
I've been vomiting. I've been coughing. I've been sneezing. I've been wheezing.
I have pain in my chest. I have pain in my hip. I have pain in my ribs. I have pain in my stomach.
So, now we know how to express our symptoms, okay? Then we have, for example, the modal must, okay? The must is a modal verb and it is sometimes used to indicate a conclusion, okay? For example, I feel nauseous. It must be the food. It must be the food, okay? I'm sneezing. It must be a cold, for example, okay? Now let's listen to a person calling on the phone, calling in sick. So let's see how that person explains what's happening to him.
Page 17. Conversation model. Exercise A. Read and listen to someone calling in sick.
I'm afraid I'm not going to be able to come in today.
I'm sorry to hear that. Is something wrong?
Actually, I'm not feeling too well. I've been coughing and wheezing for a couple of days.
That must be awful. Maybe you should see a doctor.
I think I will.
Good. Call me tomorrow and let me know how you feel, okay?
So, um, we can practice in class saying some things about us, calling in sick, trying to call in sick to our partner. Okay, so lesson 2. Make a medical or dental appointment, okay? Here we have the be able to and the might, okay? The be able to is a future ability. For example, I don't know if you will be able to, you know, to give me an appointment for next week, for example. And the might is to sound a little bit more formal, okay? Um, the dentist might have some time to see you this afternoon, for example. That might is like giving you softening, okay, a little bit the the message. Now, once we go to the doctor, we have medical procedures. Let's listen.
Page 18. Vocabulary. Medical procedures.
A checkup. An examination.
A shot. An injection.
An EKG. An electrocardiogram.
An x ray.
A blood test.
So, now that we know all these procedures, let's listen to a conversation between a receptionist and a person trying to make an appointment for the doctor.
Page 19. Conversation model. Exercise A. Read and listen to someone making an appointment.
Hello, Dr. Starr's office. Can I help you?
Hello. I need to make an appointment for a blood test. I wonder if I might be able to come in early next week.
Let's see if I can fit you in. How about Tuesday?
Could I come in the morning?
Let me check. Would you be able to be here at 10 o'clock?
That would be perfect.
We'll see you then.
Thanks. I really appreciate it.
Okay. Now, lesson 3, discuss types of treatment. Okay? What do you do when you get sick or you're in pain? Do you treat the problem yourself or you see a doctor right away? This is a controversial topic, so be careful. And we have in here a listening on what to do, on what choices you have when you feel bad. So let's listen to the choices and we're going to discuss them in class.
Page 20. Reading. Read and listen.
Consider the choices. Conventional medicine. The beginnings of conventional medicine can be traced back to the 5th century BCE in ancient Greece. It is based on the scientific study of the human body and illness. In the last century, there has been great progress in what doctors have been able to do with modern surgery and new medications. These scientific advances have made conventional medicine the method many people choose first when they need medical treatment. Homeopathy. Homeopathy was founded in the late 18th century in Germany. It is a low-cost system of natural medicine used by hundreds of millions of people worldwide. In homeopathy, a patient's symptoms are treated with remedies that cause similar symptoms. The remedy is taken in very diluted form, 1 part remedy to 1 trillion parts water. Herbal therapy. Herbal medicine, often taken as teas or pills, has been practiced for thousands of years in almost all cultures around the world. In fact, many conventional medicines were discovered by scientists studying traditional uses of herbs for medical purposes. The World Health Organization claims that 80% of the world's population uses some form of herbal therapy for their regular health care. Acupuncture. Acupuncture originated in China over 5,000 years ago. Today, it is used worldwide for a variety of problems. Acupuncture needles are inserted at certain points on the body to relieve pain and/or restore health. Many believe acupuncture may be effective in helping people stop smoking as well. Spiritual healing. Also known as faith healing or mind and body connection, various forms of spiritual healing exist around the world. This is a form of healing that uses the mind or religious faith to treat illness. A number of conventional doctors say that when they have not been able to help a patient, spiritual healing just may work.
So, what is your favorite maybe type of treatment? How would you like to treat your disease just in case you have it? Okay? So, talk about medications, okay? Let's listen to the medications.
Page 22. Before you listen. Exercise A. Vocabulary. Medications. Read and listen.
A painkiller. Cold tablets. A nasal spray. A decongestant. Eye drops. An antihistamine.
Cough medicine. An antibiotic. An antacid. An ointment. Vitamins.
On the label of the medicines, we can get some words. Let's listen to those words.
Page 22. Medicine label information. Listen and repeat.
Dosage. Warnings. Side effects. A prescription.
So, now let's listen to the videos, okay, of this unit.
Let's get Ms. Novak's tickets ready. She may be stopping by this afternoon.
Paul, are you okay?
No, I feel awful.
What's wrong?
I've got this horrible cold. I'm sneezing, and my back is killing me. I've got this pain at my hip. My neck's been bothering me all day, and I have a stomach ache.
You may have to go see a doctor.
No, I hate doctors.
I wonder what could be wrong.
Maybe he's allergic to work.
I'm not kidding here. I'm in pain.
I used to want to be a doctor, you know. Say ah. Now I remember why I didn't become a doctor.
Paul, you really must get some medical help.
A little acupuncture might help you feel better.
Stay away from me.
Dr. Anderson is meeting Mr. Evans downstairs in the cafe. Should we ask her to come up? She may be able to help.
Great idea. I'll go get her.
You might prefer an herbal remedy?
Stop it.
How long have you been feeling this way?
Oh, I got the cold last night, and the pain in my back started this morning.
Want to try a little spiritual healing?
You're making me laugh.
Laughter's the best medicine, you know.
Oh, but it hurts.
Say ah.
Cover your face, Doc.
Well, you have a cold, that's for sure.
What about the other stuff? The pain in the back and the side?
Well, have you taken any medications lately?
Just some over-the-counter stuff. Painkiller, cold tablets, nasal spray.
Well, that sounds okay.
And some cough medicine, vitamins, and acid.
That's a lot of medicine.
And some decongestant.
That's too much medicine in one day.
That must be why you're feeling so bad.
Have you been around anyone else who's sick?
My friend Donna's had a cold all week. We lifted weights last night for about an hour, ran 5 miles. He had to walk the last mile.
Is that your usual exercise routine?
Yep. I started it yesterday.
Well, that explains it. You exercised too much.
That's all?
That's all.
A little chiropractic treatment might help you.
Stay away from me.
Are you traditional in your medical ideas? That is, do you kind of believe in Western medicine, or do you like to explore non-traditional treatments such as acupuncture or homeopathic medicine?
I don't explore non-traditional treatments as much as I would probably like to. I think there's probably a lot of merit in them, and they haven't been studied enough.
I'm more traditional than anything else in my medication or my medical practices.
I'm more for the naturalistic approach. I like, more natural herbal medicines.
In your opinion, what are the advantages of traditional Western medicine and surgery?
I think the enormous amount of research and proven fact that's behind our medicine just makes me feel more comfortable with it.
What do you see as maybe some disadvantages of Western medicine?
I think at times Western medicine can make the problem worse in trying to make problems better.
Are there any non-traditional therapies that you use?
I drink a lot of tea, actually, so I guess that's pretty non-traditional.
Usually when I feel myself coming down with something, I will take an echinacea, which is an herbal medicine. Prior, drink a lot of orange juice, since vitamin C helps you. But if I feel really sick, then I'll take a cough medicine.
Thanks for fitting me in. This heart is killing me.
Ooh, that must hurt. Are you in a lot of pain?
Yes, I thought I'd better see someone right away.
It might be an emergency. Could you try to explain?
Give me something to keep me from falling apart. Doctor, won't you please take an x-ray of my heart? You know I'm here on business, and today I saw a guy.
Why don't you have a seat while I do some simple tests?
Thanks, as I was saying, he walked by without a word.
So that's what's bothering you. Just go home and get some rest.
Give me something to keep me from falling apart. Doctor, won't you please take an x-ray of my heart? The minute that I saw him, I felt weak in the knees.
Are you dizzy, short of breath? Does it hurt when you sneeze?
Yes, I have all those symptoms and a pain in my chest.
Well, love at first sight can have painful side effects.
Now, I might not be able to go to work today. Could I get a prescription for some kind of medicine?
Well, let's have a look now. You might have to heal yourself, or try another treatment for the kind of pain you're in.
Give me something to keep me from falling apart. Doctor, won't you please take an x-ray of my heart?